All right, there goes nothing. Hi, everyone. How are you today? I hope you're doing good, and I hope everyone is staying healthy and safe. Um, well, I wish we had a better time to share this lecture with you, but this is the time we're living these days, so we'll do the best we can. I'm sure you've been overwhelmed by all the events and especially the information that came after the 180-degree switch and everything. But I'll hopefully try to make it as easy for you as possible. I will first go over some of the changes that I made. So I'll share my screen with you. 1 second here. Here's our course. Is this the one? Here we are. That one is extra. Okay. So I put some, please stay up to date with all the announcements that I made. The latest one is about the class format. This week will be independent study. That's why I'm recording this lecture. And the following 4 weeks, we'll have presentations. So if you go into contents, it's coming. Table of contents here. If you keep them all collapsed, you'll see all the new stuff down here. I guess I should share with you the student version because there's a lot of junk there you don't need to see. That's cleaner. Table of contents, collapse all, so you can see everything that has new next to it. You'll see some changes there. Syllabus and weekly outline, everything that has a new with the asterisks there, especially the assignments. I would like you to take a look at that. Here's the summary of all those stuff in purple is new or modified. Down here, the new quantitative project, and then here's a summary. Why do I have it twice? I'll check on that. This is a new one, SMART objectives. This is an individual assignment. Iowa model, there will be another group project. What I had to do is reduce the number of the final exam and then distribute that into quizzes and other assignments. Anyway, so that's pretty much it. I know there may be some confusion, but please just read the instructions, read the new rubrics. I tried to make them as easy as possible and accomplished in an objective way. So today, what we're going to talk about, as you can see, we squished the content from week 9 and 10 that we lost into weeks 11 and then 12, 13 for presentation, week 14 and 15 also for presentations. So if we look at week 11 here, you have the topic of the day is applying evidence-based practice in nursing. And the chapter that we're studying is chapter 16, which is very important You're going to need that for your evidence-based practice paper. You're going to need that for the Iowa model. There are some articles here, Duty 2011 and Huther. That's how you introduce evidence to nursing practice, and also an example of applying evidence. Also of interest to you would be the evidence-based practice part 1, how to. And this gives you instructions on how to do the theory or the theoretical framework of your proposal. And don't forget, when you do all these group projects, to just give feedback for your peers, because I really need to know who's doing what. And we'll be due also the end of next week is quiz 1, which is an easy quiz, which will open March 30th. And you have a whole week to finish it, but it's time limited. So make sure you have enough time and quiet place to do it. Also, your Iowa model group assignment is due, and the theory part 1 is due. So let's get to it. Let's look at the summary of the course, of the module today. And these are the things I went over and we saw. Here's the objective. We want you to be able to synthesize key components from evidence-based nursing practice to drive the provision of quality nursing care. This is our goal from evidence-based practice, and demonstrate the effective use of the research process, because all of our work depends on research when you do any activity, especially scholarly activity or evidence-based activity. Key terms, you have these terms here, look them up in the book, they're easy, and we'll talk about them. Integrative review, meta-analysis, systematic review, and research utilization. We'll talk about that as we go. So here's a summary. This is summary for chapter 16. Let's make it bigger. All right. So application of evidence-based practice with research. Just as an introduction, in the last few weeks, we have seen a lot of, if you've been following the news and watching what's happening, you know, around the world in terms of this pandemic, you'll see some people, you probably read a lot of junk online and fake news and people's opinions about why this is happening and who did it and why and what is the best way to treat it, and you know, all the opinions. Everyone is an epidemiologist these days, and they tell you, everyone tells you a story. Some people are bringing up things that are unrealistic and can be dangerous sometimes. And the basic thing here for us is to stick with what we know works in terms of scientific process. I personally would not listen to what a politician has to say about epidemics. There's always a political drive or motive behind what they say, but I would listen or follow what scientists say, what epidemiologists, what people who are the experts say. And this really fits well with what we're doing here, because the whole idea of evidence-based practice is to follow the evidence and generate evidence if we don't have it. If you don't have enough evidence that leads you to questions, would lead you to more inquiry. And that means you don't just take someone's opinion, or if there's weak evidence or non-existent evidence and someone says, you know, I think this works, then let's do it. This can affect your work. It affects your patients, affects your their well-being, even their life. An example is chloroquine. There was a lot of talk and hype about, well, chloroquine, which is something that is treating malaria. It's been around for 70 years. And people have used it, trying to throw everything they have on this virus, but there is no enough or sufficient convincing, strong evidence that it actually works and it's safe and effective. What's the point in having a drug that is not safe or not effective or neither one of those? If it worked in one case or two cases to some extent, doesn't mean you just apply it to everyone, because that's not enough evidence. If it worked in the lab or on mice or some way where it was tried, it doesn't mean you apply it to the general population at a wide range and wide spectrum. So let's keep that in mind. So for our definition for evidence-based practice, it's a process for using confirmed evidence. That's a key. And where does the evidence come? It comes from studying the problem. It comes from research. And it's helps us with decision making, and it uses our judgment as nurses, as people with expertise to discern what is good evidence and what's not good evidence. And eventually it will guide our delivery of holistic nursing care. And we talked in previous classes about how evidence is divided into different levels or categories, and how for us to pick the strongest evidence. And it's been advocated for by nursing organizations and medical organizations around the country and around the world. The first step of using evidence is understanding the research process. That's why I'm saying, don't listen to a politician, listen to a scientist, listen to the doctor, listen to the nurse, listen to a researcher who does this work for a living, and understand what the research process means and how we look together throughout this semester on how research works. So that's where the key is. If you don't understand the research process, you might be convinced this way or that way, but it may not be the best choice for you. Don't worry about the historical background. We used to practice nursing by culture. Each country or each hospital or unit has its own culture, and the senior nurses teach the junior nurses. In time, those junior nurses become senior nurses and they teach the next generation. So it's not always, hasn't always been enshrined where evidence is key, that we should it should guide our practice. But it's not an easy thing to do. People usually resist change, and not everyone can analyze and understand the research process or analyzing the evidence and finding the strongest evidence available. When you're in practice, you want to do the best that you have to give your patients the best outcomes. So you start with a question or a dilemma, and you acknowledge there is a problem somewhere, and that leads you to the PICO question. And the PICO question, we'll see in a minute, it stems from a problem that you see or you observe in practice. And this can take you in multiple trajectories. If your PICO question can be answered the way you formulated it, and you can find the evidence behind this question or that supports your endeavor, then that's great. But sometimes you don't have the enough evidence or hardly any evidence behind it. Does that mean you give up? Of course not. Your trajectory can be either a research project or a research venture. There's more details in the book. But basically, if there's a gap in knowledge, we have to fill that gap. And that, we have to do additional research in whatever format. However, the data needs to be collected based on our question. But if there's enough evidence that we could follow, we just go with the evidence. We use what's available to, sometimes you have to use the best available. And you test it and see if it works. That's not, easy sometimes, but you do the best you can. So these are some of the critical steps that you use during, your adventure with evidence-based practice. There is a question, you raise that question. You find the evidence or look for it or assemble it. And then you think, oh, here's a good, amount of literature on this topic. And then you start evaluating. Remember, critiquing research? That's where your critical skills in research will come to fruition. When I heard about that French study about chloroquine, I read the study. We understand the urgency of this, but the study did not claim to be a randomized clinical trial on a large number of people or in a very controlled environment and good tracking of patients. It was kind of a weak study to start with and a small number of patients, so it didn't rise to randomized research, randomized control trial. So what it wasn't, was some evidence, but it's not convincing. So then you put this evidence, you plant it or simulate it into clinical practice. And that's not easy either, because sometimes you need to change people's attitude or how they accept the evidence itself. And then after you implement evidence, you want to assess or evaluate the outcomes. So whether this evidence was helpful, was not, is it appropriate to this area of practice, or is it not? Those things remain to be seen, and you have to do some evaluation. And as we all know, the PICO question, or the acronym, stands for Population, Intervention, Condition of Interest. Sometimes we call that comparison, if it's available. Outcomes of interest. Everything we do is, leading to some outcome. And then the time. So when you formulate your question, you put time to limit your activity so you don't spend, the rest of your life searching for an answer. Your question should be clear and concise, and this will guide your search for evidence in your process. So you do with research, you look for literature, whether it's on libraries, whether it's in databases online, whatever the source. These days you have a lot of resources at your fingertips. Most of the literature now is available online. You hardly need to go to the library unless it's some old, something that's not online. But you can find also summaries of the literature, things that experts put together that help you basically find evidence in one place. For example, a meta-analysis. Again, those are all terms in the book. A meta-analysis where it's a collection of studies that study the same phenomenon and from different perspectives or in different locations or different times. And then experts put the data together and reanalyze it and focus it on one common question, and then publish the results. This could be very helpful. A systematic review, it's a literature review, and it expands the view or the lens on the available literature, and it puts out a summary of what's out there without putting judgment, but it says this is what's out there. An integrative review is like a systematic review, but it's also comes up with interpretation of those results and makes recommendation based on them. So that's kind of the step higher. So there are, levels of evidence. When you evaluate it, there are levels or strength of the evidence. As we've studied before, we saw, how things are categorized. If you look in the material for the last lecture, I believe, you'll see there in the book these steps up and the pyramid. We looked at those before. And, as I mentioned, your critiquing skills need to be sharp, need to be objective and alert to or informed to be able to assess, what you're reading, where it came from, for example, who's involved, the sample size, the method, the population, how it was determined, and then what happened, the research design. Is it quantitative? Is it qualitative? The methodology of data collection. And then where was it completed? Type of agency, state, country. Sometimes, in the old days, for example, tobacco companies, for example, funded tobacco research. Can you imagine? Like you're paying researchers to find evidence that tobacco is not harmful, and you take it with a tablespoon of salt, not just a grain of salt. So you need to understand what the motive behind this research, where it came from. Yeah, and then when it was done. When, if something that's older, as we always say, I know we discussed this before, I still stick with the 10-year old studies or sooner. Some people are now requiring 5. We live in the information age. In the old days, it took many years for a study to move from research to practice. These days you have, as we will see in the next lecture about translational research, things that can happen really quick. So now people are talking about 5 years. You want to examine the research question. You want to examine data collection and the tool used, the statistical test, and all these controls, how studies were done. You cannot, just because something is published doesn't mean it's high quality. Even things are published, even peer-reviewed articles. Some people brag about peer-reviewed. I heard people on TV talking about that chloroquine French study, and they're bragging, saying, "Oh, it's published, it's peer-reviewed." So what? If the peers let it slide, usually it's 2 peers and the editor. These are the gatekeepers. Doesn't mean they are the ultimate authority. So you, as the consumer, you have the obligation to look and assess and critique everything you read. It doesn't mean if it's published, doesn't mean it's, it's all true, or, it cannot be questioned. Questioning is healthy. So for our outcomes from the evidence-based practice process, you want to look for gaps. You want to find those, if there's any consistencies or any gaps. And this will lead you to, as I said in the beginning, that means if you found good evidence and it's consistent, it's telling you, the evidence is telling you, early ambulation helps people recover quicker. So that doesn't mean, it means we should, you know, and many times over, it's done, and we see one study after the other talking about the same thing. That's consistency. And this should be brought to practice. And then we assess how useful it is. And this helps us to confirm or to change the policies in place and procedures and our practice, whether what we're doing is consistent with the literature or not, or it can be improved. But also, if you identify a certain gap, it will lead you to more questions, which can lead you to more research. Or if these gaps exist and we can do better, then quality initiatives would be your choice. If there are any associations established from your results, then we need to find more. We need to study it a little bit more and then try to bring it to practice. So once you start reviewing the literature, you want to start summarizing it, and then bring that to people in the front end of delivering the nursing care, and give them a chance to understand it, to digest it, and then be informed when they implement these changes. It's not a healthy thing if you're, say, the quality improvement person or evidence-based practice champion or the manager or a CEO or whatever, and you bring these changes just from top to bottom and then expect people just to go with it because you yourself think this is a good place to go. It doesn't mean everyone is on board. And that means you need to have buy-in or enthusiasm from people who are doing the actual care delivery. And also you can, from what you've gathered, you can also make recommendations to maintain or change those policies that are in place already. So that, you know, all of what you're doing would be based on data. It can either confirm what you're doing is consistent, or you can make it better by recommending changes. Like I mentioned before, once you've gone through the process, then you might find some gaps in knowledge. So you might need to retrain people. You know, we tend to, if there's a skill or a piece of information that we have not used for a while, we may forget that. So if there is some gap of knowledge among your staff, you want to identify that and try to bring it up to speed. It helps if people see summaries of what you've done and from different resources, and it helps them understand where the change is coming from. That would help people be part of the change instead of resisting the change. And then making recommendations. Summary points, we talked about these things, but there are a couple of definitions I want you to see. Guides the delivery, understanding research process, and moving evidence. Process for research utilization. It's examining a study to determine the strengths and limitations assumed within a study. So this is kind of more, goes back to critiquing research and finding what is the strength and weakness of a study, whether we can actually use it as an appropriate evidence. The one definition, here they are. Meta-analysis, as I mentioned before, I think one of those or two were highlighted in the outline, in the lesson outline, meaning they're important. So meta-analysis, it's an analysis and of a bigger body of literature, a bigger body of data that comes from multiple studies. So you reanalyze analyze statistically the data from different studies. You try to reorganize it in a way that you can treat it as one lump of data, if you will. A systematic review, it's a summary of all the evidence found that is correlated to an identified research or issue. And it uses a rigorous format. You have a team of experts who are specialized in this area, and they exhaust basically the research engines and find as complete results and output as possible. The integrative review, it's like a comprehensive review or systematic review, but also it draws conclusion from that summary. So it can make recommendations based on those summaries that they made. What else? Talked about that, detection of gaps. If you have a clear viewpoint of a clinical problem, that's why you always keep your eyes and ears out and try to not just go with the flow, always be kind of go against, not just to spite others, but try to always ask why. Whenever someone tries to teach you something and tell you, oh, this is how we do it, always have that why on your head, on your mind, to understand more. And if you remember from growth and development in peds, you'll see toddlers are notorious for that. I remember conversations with my kids when I tell them something and they will say why, and I say it's because of that, and why, and then it's because of this, and it almost always ends up with me talking about the Big Bang Theory and how the universe started in the first place. That's kind of how far we went back. But anyways, we don't want every conversation to end up with the Big Bang Theory, but it will help you understand better and will help you make an informed decision, because if you're doing what you're doing, understanding what you're doing and why, that's the best way you can perform your nursing duties. And I'm not sure if I mentioned this to some people, maybe the first day of clinical, and that was the last day. I could teach a monkey how to insert an NG tube or a Foley catheter or give an IM injection, but the monkey is not going to understand why we're doing that. And that's a human higher level of thinking, that you know there's a problem, you address it in a knowledgeable way, in evidence-based way, why you're doing that, okay? And then quality improvement, this is your other course that focuses on that. We're not going to dwell on it too much. I think this is it for now. I will sign off, and I hope you enjoy the video. I will upload the video to YouTube. Well, obviously now you are watching it on YouTube, but I think to make it easier on YouTube, I'll leave the comment section open so you can ask questions, hopefully, if you have questions, or you can link it to Ask the Instructor forum. For now, we're done for this, and I will be working on the next one soon. So thank you, and we'll see you soon.